Welcome back to our Educational Diagnostician series. Today we're going to talk about standardized testing procedures. So specifically when you're in that role of administering different tests, there are some things that we have to be really mindful of and some things that can also just help you get better test results by being very conscious of the environment and all the situations around the testing. So what we're going to cover in our agenda for today is using standardized instructions that are part of the testing procedure, things to consider about how we record answers and what to record, how to do queries when we are needing more information or needing to clarify a student's answer. We'll talk about basils and ceilings in the tests, as well as testing the limits and some issues around scoring. Not specific scoring for each of the tests, but just some things to be mindful of when we are scoring. So some general testing considerations that are really important is number one, to have a quiet area. And I know I've said this before, I'm really sharing the ideal. Now, when we talk about reality, it's hard to sometimes find a quiet area. Those of you who are lucky enough to actually have an office or even a testing room that you just get to use at certain times, it's usually near something else. And obviously it's near to a door that leads into a hallway, which means that anytime that classes change, you've got foot traffic, you've got noise. There can be a lot of things that can really interrupt that testing process. So just try to find as quiet of an area as you can. Also think about limiting the distractors that are in the room. If you have a lot of toys that won't be part of the testing process, or supplies that are in the room that kids get really curious about. I've unfortunately tested in rooms where like all the birthday treats were stored, and that was really hard for some kids to not want to get up and explore those things. Some of those distractions can be really difficult. I know a lot of you will share spaces with other educational professionals, sometimes using the same room as maybe your occupational therapist. I've been in rooms that will have the trampoline and things like that, and that can be a distraction too. You can also turn that around and use that to your advantage for break time to say, we can't touch that now, but once we get through 3 subtests, then you can have 30 seconds on the trampoline, or you can play with this item for a certain amount of time. It is helpful to have a do not disturb sign that you can bring with you and hang on the door. You can usually get those at conferences. A lot of companies will give those away for free, print one out and laminate it. But having something like that, it doesn't always prevent someone from coming in, but since a lot of us do share space in buildings, it can at least help for someone to take a slight pause to see if they can enter the room or not. You know, we have some subtests that it's not a huge deal when somebody comes in, knocks on the door, interrupts us. There are others where things are timed, and that timing is critical to really being able to count on the results of the test. So we're going to try our best with trying to control that environment as much as possible. It's also important to have an appropriate size table or chair. And some of you may feel like this picture really represents what you are encountering sometimes in those testing rooms, feeling like you're sitting at a preschool chair, and maybe it's not the best situation for you, but the important thing is to make sure that the table and the chair height are right for the child. We can't have a child doing their best on test performance when their chin is resting on the top of the tabletop. Chairs that spin around or chairs that rock can be problematic for some of our kids. So just be really thoughtful about the situation that you're in and control it as much as you can. Again, you may have limited resources, limited ability to swap out some of those things, but if the conference room table is where somebody puts you and you have a kindergarten or preschool student that's really small, you may need to ask for, can I just borrow an empty desk and pull that into the room so that it's more appropriate. Think about the time of day of testing as well. Some of us are in buildings and we're just getting as many kids to our environment as we can. But some kids aren't good at 2 o'clock, and others do not show us their best ability at 8 o'clock in the morning either. So we need to really think about what would be most appropriate to work within our schedule, but also work to get the best information about the student. You're probably going to get really good information from the classroom teacher about what they see with the student in the classroom and when might the best time of day be. Looking out for things like recess time, convocations, specials, anything like that that a student is not going to be happy if you pull them away from. Using rewards, we talked in the last installment of this series about having some kind of a reward. Obviously, we like to be rewarded for the things that we do. And when we're asking students to do something that really is above and beyond what they're doing in the classroom, rewards can be a really positive thing. So I tend to have chocolate available. I tend to have backups as well. So usually chocolate, something gummy, and something non-food that they can choose from, such as pencils. Color-changing pencils are a big hit with kids. Also using different schedules, visual schedules to help kids get through the testing process and kind of know what am I in for, where do my breaks come in, where do my rewards come in, when will I be done. It helps to get you through all that, as well as helping to get around all those questions about how many more do I have to do, how many more questions do you have. Well, we never know how many questions, but we usually know approximately how many subtests we need to get through. It's also important to give an appropriate explanation of what we're doing to the student. I try to never use the word test. Test usually implies grade. And a grade usually implies I could potentially fail this. So when we steer clear of the word test and just talk about kind of what we're trying to do with our assessments. So for younger kids, I may tell them, I want you to do some things that are kind of like games and puzzles. I may ask you to do some reading. I want to see what you're really good at, and I want to see what things that might be a little bit harder for you. That's usually about enough explanation for kids to be satisfied with why am I here, who are you, that kind of thing. For older kids, they may have been involved with the conversation with the referral for testing. In fact, they may have been the person who has said, I really think I need to be tested. You can be a little bit more explicit with some of your information with older students or students that are capable of understanding. But again, I try to stay away from the word test and just talk about where we really want to get in and find out the best way that you learn, the best way that you tend to problem solve, and ways that tend to be harder so that we can help work around those things and figure out better ways to support you here at school. I am very clear with all students in saying, I can't tell you how you did on certain things. I can't always tell you whether you're right or wrong, but what I can tell you is whether I think you're putting in good effort. I can tell you how many more, and afterwards I can go over all of this information with you and let you know how you did. But I won't be able to tell you right away how you did on something. So just letting them know a little bit about that, as well as telling them that no matter what the outcome as far as their performance on a particular assessment that we do, they won't get a grade on it and it won't show up on the report card. And I think that's reassuring to a lot of kids to say, okay, you know, this is great, but I don't want this to be something that is causing me anxiety that it might affect whether or not I pass on to the next grade or whether it's going to influence my GPA or something like that. So when we give standardized instructions, it's important that we stick very closely, I mean exactly, to what the test manuals tell us to say. Standardization is really important because as instruments are normed on a group of students, they are given the exact same way with the same instructions to every student that's part of that norming group in order for us to really know that the scores can be meaningful. So when you have things that are to be read verbatim, you need to make sure that you are doing just that you have the manual out in front of you and that you're reading exactly what the instructions say. Usually in manuals, the standardized instructions are marked. They're either in a different color or highlighted or in bold, but if you are to read something verbatim, it specifically tells you in the manual to do that. There may be other standardized procedures such as timing, how quickly you read something, how quickly you administer something, how to, in what order to give things. There are a lot of things that we have to read those manuals basically from cover to cover to make sure that we're following those instructions correctly. There also may be some procedures specifically about when we give instructions to point to an item or to gesture or to give a head nod or something like that. All the tests are slightly different in what we have to do, but you have to make sure and know those things inside and out before you administer a test to a student. Usually when tests have teaching or practice items, there are very specific instructions about what to say, both when a student gets an answer correct or when they give an incorrect answer. So it may specifically have you ask a question, and then if the student is correct, there are verbatim responses to say, that is right. And then you go on to say something else. If they get the answer wrong, there are also usually instructions about exactly what to say back to the student so that we're reteaching exactly the same way with everyone that needs it. There are also very specific guidelines in a lot of tests for feedback, whether you can say yes or whether you can say no. In general, with most items, we do not give feedback to students. We don't tell them, you're right, good job. We may say good job or you're working really hard, but we don't tell them that's right or that's wrong except on specific items that allow us to do that. Now, we do have a lot of students, especially students that are very high in anxiety, that ask almost constantly for that reassurance. Did I get that right? Am I doing good? It's important that we are reassuring, but that we're not guiding them to know whether an answer is right or wrong, because that can change the outcome of what we get. When we're recording answers into the actual test protocol, you need to follow the directions of the test. So some things specifically have us marking yes or no. Others will have us marking 0, 1, or 2. 1 or 0. It just depends again on the particular test, and subtest may tell you something different. Be very subtle as you record things and make sure that you're not, this is kind of like playing poker. We don't want to have any tells. So if I only mark when a student gives me a wrong answer and start writing and recording something, they're going to pick up on that very quickly that, oh, I must have gotten that wrong because she's got the pen going again. So we want to make sure that we're making kind of subtle marks. I shouldn't make such big marks that you can clearly see whether I mark an X or a 1 or a 0 or a 1. You can watch hand movements and figure that kind of stuff out. And so again, just trying to make things as subtle as possible, keeping the protocol in a place that a student can't see what you're doing. And a lot of our manuals, we know, kind of stand up on their own, which is fascinating to kids too, of how does your book do that? But if we can have our test protocol, I'm a left-hander, so I typically have students sitting on my right-hand side so that I'm writing behind the test manual, and so you can't see what I'm doing, and you can't really see those movements either. There are some specific test items that we should be recording answers verbatim. And sometimes we have very verbose kids who give us a lot of information, and sometimes I'm like, give me just a minute because I need to write down everything that you say. And if we're writing a lot, sometimes I will say that if a student does look anxious as well, to say, boy, you're giving me a lot of information. I've got to write all this down so that I can read it later, and so that they don't wonder what all I'm writing. I also make sure to record anytime a student asks a question, anytime they ask for me to repeat something, as well as when they self-correct answers. They give you a wrong answer and then say, oh no, wait a minute, and give me a different answer. Or when they kind of spoil an answer. They give me a correct answer and then they change it to an incorrect answer. Looking at some of those patterns can tell you a lot about a student, and it's good information to have in your report as well if that tends to be a big issue for a student. So recording those things, having a system so that you'll know exactly what that means on your protocol. So if they ask for a repeat, I put an R. If they ask for if they ask a question, I'll put a Q. You know, things like that. Self-correct, SC. But have your system so that you know what that means, so that you can quickly mark that down, but then know later when you're writing a report exactly what happened during that session. Many tests also have specific procedures for when you need to query a student's response. So there may be rules about when you can ask for more, or in items where you have to have maybe 2 answers and the student only gives you 1, there's usually a procedure for saying, tell me another reason that, and repeating the question. But it's critical that you have those manuals up in front of you during the test administration, because you won't be able to remember all of the times that you need to ask that question. And what really is violating those standardized procedures is if at the end of the test you go back in your scoring and think, oh, I was supposed to query this and I didn't. I was supposed to ask for more and I didn't. You really can't go back to a student later and say, you remember when I was asking you about this? Tell me more about that, because you've lost the moment. It really isn't the same information anymore. But most of these do have very specific wording that must be used during the tests. All right, let's talk about basils and ceilings. They're definitely a good feature to test. It helps reduce the number of items that we need to give in order to feel comfortable with knowing that a student was likely to get everything right before the item we started with, or probably wouldn't get many more right beyond the item that we stopped with. So it kind of reduces that field of questions that we need to ask, and it can help reduce frustration for a student as well, so that if a student starts to get a number of items wrong, we don't keep pushing them all the way to the end of a subtest if it's very likely that they weren't going to get more right. So with basils and starting points and subtests, again, all tests are different, so study the manual, make sure that you know exactly, sometimes even on test protocols, if it's not clear on the actual protocol, I will make myself a little note that we needed to have at least 4 in a row in order to establish a basal, or whatever it is that I need to be mindful of. Most of them, it actually is printed on the protocol, which is very helpful. Subtests generally will have a suggested starting point, either based on the age or the grade of the child, or we'll just start at number 1. A lot of them will have a certain number of items after teaching items that we can just skip, as long as the student does well where we start. So the basal may be getting the first 2 items correct. It may be getting a certain number of items correct with full credit, as opposed to partial credit. It may be a number in a row that are correct. If we don't establish a basal, there are procedures for dropping back either in reverse order, or sometimes dropping to the start of another set of questions or an earlier start point. But again, every test is different, so you can't rely on your knowledge of one test to make sure that you know what you're doing for another test. Sometimes you never establish a true basal. You may have certain students that on subtests may only get a couple of items right, or sometimes even none. I mean, we have some students that we attempt to test and it's just not going to yield us any information. They have a raw score of 0 on something, so we never establish a true basal. But for most kids, the way the test is set up and the way it's normed, it is expecting us to be able to establish a basal at the suggested starting point for the student. Ceilings help us know when to stop. So we are either going to stop with the last question if we've never established a true ceiling, or we may have a rule for when we can stop sooner. And that rule may be a certain number of missed items in a row. It could be that we have a certain number from a group, 4 out of 6, 5 out of 6, that have been missed, and that can be a little problematic for keeping track of. And there are also sometimes when you have a particular block of items that are grouped, and if you miss a certain number out of a block, it will tell us to stop, which means that the last item that we give in a block could be correct. So we have to really know, where do we stop and where do we get credit for what we've done? So if we have to give a complete block of something and we actually got the last one in that block correct, do we get credit or not? Again, refer to your manual for the individual tests because they can all be slightly different. So there are some wonky situations out there. Sometimes we establish a ceiling while we're trying to establish a basal. So for example, maybe we've skipped ahead because an 8-year-old student is supposed to start at number 10 and they get number 10 wrong. And maybe it tells us, okay, well, you need to start going in reverse now. So we get number 9 wrong, we get number 8 wrong, we get number 7 wrong. And if the ceiling rule is 4 in a row wrong, you've established a ceiling before you've even gone back and established a basal. So sometimes that can happen. It makes for a super short subtest administration, but obviously we want students to do as well as they can and for us to get good information on the test as well. So again, be very aware of the differences in some of the test rules, because sometimes the basal is the highest group of a certain number correct in a row. So you may have one basal and then have some missed items and then have another basal that gets established later, and you have to know whether or not you are allowed to count all those items or whether you get credit for some of the things that you missed because they were below the highest basal. So it can change the scoring. In testing the limits, this is something that we typically do after a test is completed. So there are times when we establish a ceiling on a subtest. So the scoring has ended. We know what the score is going to be, but we've seen some patterns in students to say, you know what, I think they can do some higher things. So we may allow them to go on and complete some other items. You find this sometimes when you're giving maybe a math calculation assessment and we're ready to stop a student because clearly they've missed enough to establish a ceiling. They're not going to get credit for anything else. But they point to some items on the other page that's open and say, well, I know how to do that. Well, let me see you do that. That gives us information. It doesn't change the score, but it certainly gives us information that maybe the student has some higher level skills, but they have some holes. And that tells us more about the student and can lead to better recommendations. We've also had some times when students, when we can look at their errors and they have stopped a subtest, but we see like the same pattern of error over and over again. There are some times when I have then, after we're done, said, you know what, I want to teach you something really quick, such as long division. Show them the steps of long division, and sometimes you see that light bulb go on, and then give the kids some of those questions again and see, can they apply that skill? It certainly tells us a lot about a student. If we can teach them something super quickly, they can absorb it and they can apply it, then it may just be that they learned a process wrong, and that although my score may be low, maybe it's not a disability in that area. Again, we're looking at all the available information, and sometimes testing the limits can give us additional information to include in our report. Sometimes we also ask the student specifically about the process that they use within a particular response that they have. And some of our tests will actually prompt us to question the student about what process, what skill set they used, how they were attacking this problem. Recently, I saw in a Facebook post in a school psychologist group, and the person had posted that they just had such a quirky situation where they were having a student repeat digits backward, and they asked the student, okay, I'm going to give you a sequence of numbers, I want you to repeat them backward. And the psychologist said 1, 5, 7. And the student looked, kind of had that look of I'm processing, and the student's response was Nevis, Evif, Eno. That student got a 0 for that item because they didn't say 751, but they did something a heck of a lot more difficult than what we were asking them to do. And we were looking for, can they hold things in memory, flip it around, manipulate it, and then give it back to me? And really this kid could. So now, if we had just let them go through the entire test, it would be 0, 0, 0. And that's a really unusual kind of situation or example, but sometimes we need to know what were you doing here? I've had some kids make some really unique errors, and I just thought, okay, they don't get it. Well, they got more than I really knew that they were getting. They were just doing something different than what I was asking. So in scoring our tests, a lot of our tests are very concrete, very easy to score. It's either a right or wrong answer. You had the correct answer or you didn't. But then there are other things that are a lot more difficult, that we really have to use specific scoring guides that we have. And probably the most difficult would be scoring our writing task, or sometimes scoring our oral expression tasks. And those things can be very challenging. And I know there have been times that I've been scoring a subtest, and I'm going back through the manual and I'm looking through all the examples. But sometimes I'll reach out to colleagues and say, this is what the student said. How would you score this based on the manual? Because the manual will give you lots of examples, but those examples are not exhaustive. So sometimes you've just got to really dig into professional judgment. And even if you're very confident in your own professional judgment, it certainly doesn't hurt to get a second opinion from someone else so that we provide the best scoring and the best results that we can for the student. So some tips and best practice items to look at when you're administering a standardized kind of procedure. Number one is just practice, practice, practice. So make sure that before you give a test that counts to a student who needs you to evaluate them, that you have read the manual, you have practiced on your children, you have practiced on your husband, you have the dog or a teddy bear sitting in front of you and you're practicing. So it's not just reading the manual, but going through the motions of timing the instructions, pointing when we need to point so that you're not fumbling it when you're actually sitting with a student. There are some tests that I don't give very often, and so when I do administer it again, I have to review it. I have to make sure I know what I'm doing. I have to write myself a post-it note that says, don't forget, you need to point when you're at this point. So some of those things are really important to just rehearse and rehearse until we feel like I'm ready to give this to an actual student. Definitely use those manuals. Keep them out in front of you. Don't rely on your memory, because as much as we like to think we have given a test so many times that there's no way we could deviate from the standardized instructions, we do. We drift. And you know, it's important that we stick to that standardization. You can ask for peer observations occasionally. You know, tell me if I'm timing this right. For a lot of us in our training in school in administration of assessments, we had to take videos of ourselves administering things so that professors or assistants could check things like our timing, check and make sure that we were giving things using those standardized instructions or procedures. But having a peer give us some feedback is not a bad thing. And especially if that peer can be a member of the multidisciplinary team, then they can be part of that evaluation process and even working in more of that kind of arena-based assessment procedure. Also make sure and check your scoring. We are human and we make errors. And you know, a lot of our things are automated now. So those of you using like Q Global or something like that, we don't have, I think, as many errors. Pretty much everything I do is still hand scored, and I have to check and recheck and make sure that I didn't look at the chart wrong and that I didn't give it a 1 when it should have been a 2 or something like that. So always look back over your numbers, your totals, and if nothing else, eyeball them to make sure that they just make sense. That, boy, I thought this kid did really well, and I find a 68 standard score on this. How can that possibly be? It could have been an error of just me calculating a total wrong. So very important to recheck those things. Well, hopefully most of you are already pretty well versed in those standardized procedures, but making sure that you help new colleagues as they come on to know how to administer different tests, and just the critical component of that is sticking to those standardized procedures. We hope that you'll continue to join us for the rest of this series and be part of our learning cohort.